Well, hello everyone, and welcome to Painless Universal, a conversation with myself and Welsh. Today I'll be talking about the vaccination. So many people are still reluctant about getting the vaccination. There's been the question about, is there too much information or is there not enough information about what are the side effects, what happens to me, what are the long-term damages of having the vaccination. I'll be talking to an amazing doctor, Dr. Amir Khan. He's a general practitioner GP, as we call him, an NHS doctor, best-selling author, and a GP on Lauren Kelly at Lauren Show, and also Good Morning Britain. He's an ambassador for the Wildlife Trust and Save Butterflies. He's a columnist at Yorkshire Life magazine. I'm really fascinated and honored that he has taken his time out to speak to me today about his own knowledge as a general physician, a doctor, a BAME Black Asia minority group, to talk to me about this critical issue, especially affecting the Black Asian minority group, not being willing to take on the vaccination. Why is it important? What we should be doing? What information we should be sharing? I'm so excited to talk to him about this. Meet Dr. Amir Khan. Well, hello everyone again. Welcome to Painless Universal, a conversation with myself and Welsh. As I said, the misinformation about the vaccination is out there. So many people, especially from the ethnic minority communities, are still reluctant to taking this on. I have the amazing doctor here with me, and he will be telling us about the reason why you should ignore that information you're hearing now on different communities, wherever you're hearing this from. Think about it, listen to Doctor as he shares his own insight. Dr. Amir Khan, how are you?
I'm really well. Thank you for having me.
I'm so glad. I am so glad you said yes, because I think right now it's such a critical stage. So many people are saying to themselves, oh, the vaccination is something I want to do, but I'm not quite sure if I should do it. But I'm not even going to dive into all of that, because our show is also about your own personal view about who you are. Because a lot of people will be saying, okay, who is Dr. Amir Khan? And I'm also keen to understand, who are you and why did you become a doctor?
I'm a GP, so I'm a family doctor in the UK, and the reason I chose to become a doctor, I guess, is similar to lots of people. I wanted a job where I could make a difference to people, that I could improve people's lives by often it's just by listening to them and asking them how I might be able to help them, rather than telling them what to do. And I quite like this idea of family medicine, because I've been working here at this surgery now for 12 years. And I've got to that point now where I've seen babies born, I've seen children grow up, to almost teenagers, and really get to know families. And I think that's really important for health, because your relationships that you have with other people, with the things around you, are huge in terms of impact on your health. And I think understanding that is really vital. So I'm a family doctor. That's who I am.
And so, as a family doctor, because I know what you mean there, because I've been with my GP for I think many years, and he knows I have sickle cell anemia, and he knows me inside out every time I go in. And when I ask for certain medicine, he'll be like, "No way, I don't think this will work with you." Remember when you said that? Do you find you have this personal relationship with people, especially when they come to see you? Do you find that you have this, I know you well, I've been seeing you for, do you have that relationship with them?
Yes, I certainly do. With the patients I see particularly on a regular basis, who I speak to on a regular basis, or who I may have helped through one particular incident in their lives, and we got to know each other over that one episode. I do feel like I know them, and I have a personal relationship with them. And I think that's really important when you are disclosing really personal information to someone. And yes, I'm a doctor, and I'm bound by all the laws of confidentiality and clinical side of things. But I think you do have to feel really comfortable with your family GP, and really feel that they understand you and that they're an advocate for you. And I hope, I mean, you better ask my patients, I guess, but I hope I have that relationship with my patients.
I hope so as well, because it's true. Because it's if I have to see a different GP, I feel very uncomfortable because I feel like you don't know me and I have to start my story again. But I would rather see someone who knows me and I don't have to start the story again. Someone who I don't have to start, oh, okay, tell me about your story again. So I do understand where you're coming from, that relationship is very important. You know, but coming now to the seriousness of what's been going on with the pandemic has caused so many changes, and I mean, I'm sure even the number of patients you've seen and the way you do your general practice is no longer the same, because I know I can't access my doctors as easily as it was before. You can still see them, but it's still quite difficult because you now have to use all the IT technology. Before I even go to this vaccination, I want to understand on your side, because a lot of people are asking me this question, between people with chronic illnesses, asking the key question: how are you guys making it easier for people with chronic illness to access?
I think that's a really important question, because things did suddenly change for patients. You know, once, you know, we as an organization, we decided actually we can't have people just coming in because of the risk of infection to staff and to other patients. We made a very a decision really to actually just allow access to those who really needed to be seen, and anyone else who could be managed at home, remotely, on the phone, via emails, all of this kind of stuff, we would do that. I think it's important to say that GPs are still seeing patients who need to be seen, and certainly I've been seeing patients face to face this morning, and I know my colleagues in the corridors have been doing the same thing. With chronic diseases now, you should be going for your routine blood tests. You should be going for your routine blood pressure checks as part of your chronic disease management. You may have a review once we have the results over the phone, but all of that face-to-face stuff should still be back in place now. So if that isn't happening, you probably should question your general practice, because we are doing that. Now that most of us, particularly the clinicians, have been vaccinated, that risk is lower in terms of protecting ourselves and protecting our patients. And often these people with chronic diseases have had their first dose of the vaccine as well. So we are reintroducing it. But I completely understand that it has been difficult. I work in a city called Bradford. It's a very multicultural city, and language is a barrier to a lot of our patients. And doing things on email and doing things on the phone isn't easy when English isn't your first language. So you know, I really understand it's been hard for patients, but we are starting to open up now, and hopefully you'll see a difference in the way you can access your GP now.
I'm so glad you said that, because I think that will make a lot of people very comfortable knowing that things have started to open up. The language barrier, because for a lot of people, culture background, they feel shy just talking about their Instagram. I don't know why, but they feel shy about talking about it over the phone. You just feel like, I'm not talking to the real person. And that brings my question to the vaccine. I said, doctor, have you seen the benefits? No, this is just an open question. Have you seen the benefit of the vaccine as a doctor?
No doubt I have, no doubt. So again, because I work in Bradford, it's a socially deprived city, it's a multi-ethnic city, and both of those have meant that we've seen higher number of people get infected and die from the virus, and the hospitals have certainly been overwhelmed. My sister works as a consultant in the local hospital, and I've heard all about it. I look after the patients once they come out of the hospitals. Our nursing homes that I go and see patients in have been really affected by the coronavirus. But we have seen a significant improvement over the last 4 to 6 weeks in particular. I haven't had a nursing home positive patient for coronavirus for a month, and that is incredible. That's not happened for a year for me, and we've certainly seen, you know, the letters coming back from the hospital about patients who have died with coronavirus. The frequency at which we are getting them has significantly reduced. So the vaccine is making a difference.
Yeah, I am, as you can see, I'm a Black girl myself, with chronic illness, which is sickle cell anemia. And when they said I should do the vaccination, I was a little bit apprehensive. I said to myself, am I guinea pig here? But at the same time, I thought about it and I said, I do the flu jab, I do the pneumococcal, I do all of this, and I never question it. So why am I questioning this one? If this will make me stay away from hospital rather than going for sickle cell attack, I should go ahead and do it. But one of the things I've noticed is that the Black, Asian, and minority group, there's that hesitation to go ahead to take up the vaccination. There's either the discrimination or mistrust, misinformation, religious belief, social problems. In your opinion, why why are they reluctant in doing something that could save millions from dying?
Yeah, the reasons are really complex, and you've outlined a lot of them there. We've got to remember that this isn't a new phenomenon. So yes, you're absolutely right. People from minority ethnic backgrounds, Black like yourself, South Asian like myself, aren't going forward in the same numbers to get the vaccine than white Caucasian people. But that has been happening for other things in health. You know, when we look at cancer screening, cervical, breast, bowel screening tests, we see lower numbers from minority ethnic backgrounds going forward for them. When you look at childhood immunization rates, it's lower in minority ethnic backgrounds when compared to white Caucasian. And the list goes on, really. A lot of it is historical. You know, we talked a little bit about social deprivation. If you're from a minority ethnic background, you are more likely to live in a socially deprived area than someone from a Caucasian background. In the UK, the statistics are really wide. You know, if you're Bangladeshi, for example, you're 24% likely to live in a socially deprived area compared to 2% if you're white Caucasian. And that is crazy as far as I can see. People from minority ethnic backgrounds and socially deprived backgrounds have been hit hard by the pandemic. And I don't think enough has been done to address that. And I certainly feel, you know, people from minority backgrounds have been let down in terms of protecting them from the coronavirus at the peak of the pandemic. And that includes those who aren't frontline workers, but also those who are frontline workers, because we saw a lot of frontline workers die with COVID. And part of that reason was their ethnicity, and we saw them die in higher numbers compared to white Caucasian people. And I don't think the response was good enough. I think it was acknowledged, but what was done, and that sows the seed of mistrust in the authority, in the health services, and all sorts of things. Particularly for South Asian people, religious holidays took place during the pandemic, and things like Eid and Diwali, and local restrictions meant that they couldn't celebrate it in the same way. And I'm really sorry. I don't know if that's the same for people from Black African backgrounds. I'm assuming it is, because it's been a year, and I assume you've been affected by it the same way. And all of this kind of thing that where decisions are made from above. And there's a mistrust of authority, and it affects you personally, will make you mistrust that authority even more. So when they then say, come forward for your vaccine, you're like, wait a minute, you haven't looked after us up until now. Why should we believe you now? And then combined with that, you've got all this misinformation on social media, on various platforms, telling people, because they know people from minority ethnic backgrounds are vulnerable to this, because we've got that hesitancy. So they will target us with information saying what the vaccine does to you, what the vaccine contains, all rubbish, but it will just cement that doubt in you. And also now, you know, when we're talking about people from minority ethnic backgrounds not coming forward for the vaccine, what I don't want to do is blame them for that, because I think when they hear it on the media or on the television or whatever, you know, they may think, well, you know, why do they keep telling me I'm not going forward for the vaccine? Why don't they try and understand why I'm not going forward for the vaccine, and actually take some of that responsibility themselves? Because that's part of, you know, the media, the way things are portrayed in the media for minority people is part of the problem as well. So all of that feeds into this hesitancy, and I'm hoping we can clear up some of, particularly some of those social media myths today. So if anyone's got any concerns, I'm happy to kind of myth bust a little bit today.
Yeah, no, absolutely. I love that what you just said about the myth, because also the language barrier. I think you know, for example, you see people arriving from the ban list countries, and they say there's a fine of £1,000 and £10,000 if you don't do the form appropriately. But some of these forms are so complex. I've got a lot of people asking me, oh, I don't even know how to fill this form. I'm not. So Is that information, lack of information out there that's really affecting a lot of ethnic minorities, that fear of, I don't understand within what I'm reading. And is there someone, and because everyone is so busy now, it's so difficult to reach anyone on the phone who could do a translator for you. I think that's also,
Yeah.
that's a big concern.
Huge. Yeah.
Yeah. And another thing I want to ask is, because a lot of people might not understand why are we always emphasizing the Black ethnic minority. What are the Asian? What are they contributing? Could you just tell me a little bit about the role they played during the pandemic? Because people might not know. People were like, okay, why are we still concerned about them? But I'm sure, presumably, they did play a big role during the pandemic, right?
They played the biggest role. We've got to remember that people from minority ethnic backgrounds are far more likely proportionally to work in frontline roles. So that could be in the health service, it could be in care, it could be in transport, it could be in retail and shops, essential shops, that have kept the world going, kept people fed, kept people healthy. We are far more likely to play a part in those roles proportionally than white Caucasian people. And I'm not saying they haven't played a role, I'm just saying proportionally we are more likely to do that. So we've been essential in this pandemic, essential, and which is why it's now really important that we protect ourselves. We've spent so long protecting everyone else, looking after everyone else, but it's time for us now to protect ourselves.
Absolutely. So, in your words, how can the vaccine help us?
So there's a number of vaccines out there, but essentially what they all do is reduce your risk of developing severe symptoms of coronavirus and ending up in hospital, and reduce your risk of dying from coronavirus. Really significantly reduce your risk by over 90% when you've had both of the vaccines, Pfizer, the AstraZeneca one, the Moderna one. They are really, really good at reducing that risk. And there's increasing evidence now. It's not definitive yet, but there's increasing evidence that it can reduce your risk of transmitting the virus to other people as well. So there's loads of benefits, because you may be at risk, you may be eligible for the vaccine, but you may have some younger, healthier people in your household who haven't had it yet. But by you having it, you're also protecting yourself as well as them. So it's really important that you do go for it.
That's true. Yeah, and we don't even think about it that way. That it's not just me doing it. It's not just protecting me, but I'm protecting others from it as well. And
Yeah.
and that is even a bigger picture, especially when you're a mother as well. You have to also protect your kids in any way
Yes,
you can.
definitely.
You talk openly about recalling a 48-hour shift. I love that article. When I kept reading over and over again, in which you vaccinated 100 people, all of them being white. Why, when you saw that, because you are in a place where it's very diverse, because when I read the story initially I didn't understand. I was like, well, probably just in a white neighborhood, so that makes sense, so it shouldn't be that's not a big issue. But now you've talked about it, that your neighborhood, where you practice, is a place where there's a big diversity. And
Yeah.
the day you did this vaccination, 100 people were white.
Mm.
What was
Yeah.
that? What was the astonishment when you did that?
Yeah. To put this into perspective, I see patients every day in my clinic, and I can often go a whole day, just seeing people from minority ethnic backgrounds. I speak a number of South Asian languages. They like to book in with me because I can speak to them in their language. I can go a whole day without speaking a word of English and just seeing patients. I don't mind. If it makes them feel comfortable in telling me, it's great. So to have a 2-day period where my patients, who I normally see, and Caucasian white people need protecting as much as anyone else. We want everyone who's eligible to come forward to the vaccine, but it was just a surprise that all the patients I vaccinated in the initial phases in the over 80s group were all white. And I didn't really pick up on it until at the end of that period, when you have time to think about it, because it was all go, go, go. There was a couple of things that made me think is, age is a risk factor. The older you are, the more at risk you are. But we know that people from minority ethnic backgrounds have higher risk of things like cardiovascular disease, type 2 diabetes. So when we're starting at over 85s, a lot of people from minority ethnic backgrounds don't make it to over 85. And so we've already excluded, a large proportion of the society because of all those social deprivation and lifestyle measures I mentioned before, they're already disadvantaged, so they don't get prioritized. And that really, if I'm being honest, it really annoyed me, because I just thought, we've done so much to help protect everyone, and now we're being excluded from this vaccination program. And then there was the idea of myths as well. A lot of social media myths, a lot of myths via other ways of being kind of penetrated into communities. And it could be via, I've heard some really crazy things about the vaccine. And I think, like I said before, they target people from minority ethnic backgrounds, and they find their way onto WhatsApp groups, and they're forwarded to other people and all of this kind of stuff. And I think that played a part. As we moved down into younger age brackets, yes, we saw more and more people. But I found myself, certainly, when I was talking to my patients about other things, they were asking me, should they come for the vaccine? And I was saying yes, but they were telling me that their sons or daughters said they shouldn't go because of such and such a myth and such a myth. So yeah, it was really surprising actually that we didn't have any South Asian people in there, because I've got a lot of South Asian patients here, and it was just surprising not to have any in that clinic.
You're very openly, you talked about this, but where can we go about the misinformation? Where can we go to get reliable information, especially for those who can't even speak the language? Because you might say mainstream media, but a lot of people don't understand what even the mainstream media is saying. So where else can they go to get better information?
Yeah, I think that's been a part of an issue, particularly here in the UK. All the COVID briefing has been done in English on mainstream channels that my mum and dad don't watch. They don't watch those channels, they watch Asian channels. Mm-hmm. So the information they'll be getting will always be second-hand translated information. It will never be directly from the experts. Mm-hmm. And this is where you've got to be careful. So if you want to find real, true, confirmed scientific information out, the best place, and it will be in the language that your country's in, so it'll be the government website. That's the best place to do it, or the NHS if you're in the UK, the NHS website. If that's not accessible to you, speak to your designated healthcare professional. I'm quite happy to have a conversation with any of my patients in languages that I can speak or they can speak about the vaccine. I'm quite happy to do it, and GPs up and down the country will be the same. And it's an easy conversation for me to have because I know the facts, I know what I'm talking about. Speak to a healthcare professional. Don't speak to your mate down the road about it, about what they've heard, because that isn't the right way to go about it. It's too important to get the wrong information.
Yes. I have to ask you a really interesting question, because I saw this and I thought, wow, when did you realize this was a major issue? Was it when you vaccinated 100, when you did the vaccination and you did 100 people and they were all whites, or was it when you vaccinated, when the nurse came who was working in the front line, and all of a sudden she said she wasn't going to get vaccinated? When did you realize there's an issue here? Is it because of the white, the number of people that you vaccinated are all white, or the other side, the nurse coming in?
It took a bit longer. So after that first weekend, I thought, oh, there was a bit of a problem, but I didn't think too much of it at the time. And it wasn't until more and more people from minority ethnic backgrounds were asking me questions about it. And I had this student nurse sitting with me who was watching me consulting. She told me she wasn't going to get the vaccine because she was told by her mum, who had no clinical background at all, that the vaccine made women infertile. It does not. There is no evidence of that at all. It doesn't affect fertility in either men or women. You don't have to avoid getting pregnant after having either the Oxford or the Pfizer vaccine. There is no reason to believe that. And there's no, sometimes people will say, well, how do you know? How do you know? Because it's never been tested. Well, actually, scientists kind of know how vaccines work. We know exactly how this vaccine works. We know which part of the body it works on. We know exactly which molecules and proteins it works on. And there is no way, scientifically, it will affect the placenta or any part of the baby or anything like that. There's just no scientific basis in it So please don't believe that. So when I was getting those questions, it started to dawn on me because other healthcare professionals were starting to believe some of the myths, and that's what worried me. And then when I spoke to my colleagues across the country, they were seeing similar patterns, and then it started being reported on the media, and then the penny dropped that we had to work really hard to encourage minority people to come forward for the vaccine.
Yeah, saying that, that's true. I heard that as well, that anyone who's trying to get pregnant should not do it. And my sister and I were having this chat, and she's like, "Oh, I don't think I'm going to do it." And I thought, so many people, if people are thinking this way, then this is wrong, because everyone's like, "Oh, but they're trying to wipe out our generation." Then I even got videos of people who've had the vaccination and collapsed immediately. And I'm like, so is that social media platform, we're sending out information that's just not true?
Yeah.
Our final message for you is, what people are still going to have questions about this vaccination. There's so much work that needs to be done. In your opinion, how can we get more and more people believing that this is an okay thing and they need to do this to help one another?
We need people like you and I having these conversations where people can access them, people who look like them, who are taking up the vaccine and talking about why we're doing it. I've had both of my Pfizer vaccine now 3 months apart. We need to make sure, we talk about things like fertility, because someone will be watching this going, I don't want it because I want to have a baby. You can have the vaccine and still get pregnant. The vaccine doesn't contain any animal products in it at all. It doesn't contain any alcohol in it at all. It just doesn't. So a lot of those myths that are out there, we need to be talking about and really, and it has to be people like us. It has to be people who look like them, because they will trust us more, because, we're from those communities. I grew up in a South Asian community. You grew up in an African Black community. And we want our communities to flourish. We want them to stay healthy. So it's important that we spread that message.
I like that. It's true, because there's nothing, and for me, with sickle cell, I like to talk to people, fellow sickle cell warriors, because their message, or someone who's really understands me. So I'm believing, even with the vaccination, you want to talk to someone who really understands it. A girl asked me who has sickle cell, said to me, with someone with sickle cell, with any kind of chronic illness, can they do the vaccination? And honestly, I will not answer it, but I did it. I believe you should. What are your views with someone who has a chronic illness and doing the vaccination?
So if you've got a chronic illness, and for example, sickle cell, we could say, if you get coronavirus, you are at higher risk of developing complications. You're at higher risk of having a sickle cell crisis. If you've got another diabetes or cardiovascular disease, we know having those long-term chronic conditions will mean you're at higher risk of ending up in hospital and dying from coronavirus. This is why we want everyone really who's at risk, anyone with a long-term condition, to come forward to have the vaccine, because this vaccine will protect you more than it will protect someone without an underlying health condition, because they're more likely to have any just mild symptoms, but you're not. You're more likely to have severe symptoms, long-term symptoms as well, or really serious symptoms where you end up in hospital. So that's why you should come forward. If you've got an underlying condition, you really should come forward for the vaccine.
That is amazing. Thank you so much. And I'm so glad my listeners could finally not just hear it from me, but also hear it from a doctor as well, because I think I could say it, because I feel great. I'm happy I've done my Pfizer vaccination. I'm waiting for the second one. And I'm so excited. Whenever I'm called up for the second one, I will be one of the first to rush to go get it done, because I hate being in sickle cell pain, and I feel safe with it. So thank you so much, Dr. Amir, for taking the time out to speak to me today about the importance of our ethnic minority group coming out and going to do what's right for theirs.
Yeah. Thank you very much. It's my pleasure.
Thank you so much.